Today we are discussing 4th Sem Psychology, Module 1, Personality of the Learner. Personality definition, meaning and nature. Definition of personality. Personality refers to the set of emotional, behavioral and cognitive characteristics that make an individual unique. It influences how a person interacts with others, responds to different situations and process information. Different psychologists have defined personality in various ways. So, personality refers to the unique and relatively stable set of characteristics, behaviors, thoughts, and emotions that define an individual. It influences how a person interacts with their environment and responds to different situations. Meaning of personality. The term personality originates from the Latin word persona, which means mask. This reflects the idea that personality is the outward expression of an individual's inner self. It encompasses traits, habits, attitudes, and patterns of behavior that differentiate one person from another. So, different psychologists have defined personality in various ways. Gordon Allport defines personality is the dynamic organization within the individual of those psychophysical systems that determine his unique adjustment to his environment. Raymond Cattell defines personality is that which permits a prediction of what a person will do in a given situation. Sigmund Freud defines personality is shaped by unconscious desires and conflicts that develop from early childhood experiences. So, then the nature of personality. Personality have several characteristics: uniqueness, consistency, dynamic nature, influenced by heredity and environment, multidimensional. So, the nature of personality. Personality has the following characteristics. Uniqueness. Each individual has a distinct personality even if they share some traits with others. No two people are exactly alike. No two individuals have the same personality even if they share similar traits. Next, consistency and stable. Personality traits remain relatively stable over time. While people can change, their core characteristics often persist. Personality remains relatively stable across time and situation. Dynamic nature. Personality can evolve due to experiences, education, and personal growth. While stable, personality can change due to life experiences and learning. Influenced by heredity and environment. Genetics provide the foundation, but environment, family, culture, education shapes personality. Reflects thoughts, emotions, and behaviors. Personality includes thoughts, emotions, behaviors, motives, motivation, and social interaction. Personality includes cognitive patterns, emotional responses, and social interactions. Types of personality. Introversion and extroversion. Jung's explanation. Swiss psychologist Carl Jung introduced the concept of introversion and extroversion in his book Psychological Types. He believed that people have different ways of directing their energy and interacting with the world, which form the basis of these personality traits. Introversion. Introversion. Introverts focus on their inner world of thoughts, ideas, and emotions. They prefer solitude and need time alone to recharge their energy. They prefer small groups and need time alone to recharge. They enjoy deep, meaningful conversations rather than small talk. They tend to be more reflective, introspective, and cautious in social settings. Examples: writers, researchers, scientists, and philosophers often exhibit introverted tendencies. Introverts may struggle with social interaction in large groups but can be highly productive in focused, independent tasks. Extroversion. Extroversion. Extroverts focus on external world and thrive in social settings. They gain energy from interacting with others. They enjoy group activities, discussions, and being the center of attention. They enjoy being around people, engaging in conversation, and participating in group activities. They are outgoing, expressive, and assertive in social situations. They are talkative, expressive, and spontaneous. Extroverts thrive in dynamic environment and often take leadership roles. Example: politicians, actors, public speakers, and salespeople often exhibit extroverted tendencies. Extrovert learners in the classroom prefer group activities and interactive discussion, learn better through verbal communication and social engagement, are comfortable speaking up in class and sharing their opinions, may struggle with independent study but excel in collaborative projects. Jung believed that most people exhibit both introverted and extroverted tendencies but generally lean toward one dominant personality type. This concept was later expanded in personality theory like the Big Five personality traits and Myers Briggs type indicators. Balanced personality, ambiversion. Some individuals do not fit strictly into the category of introvert or extrovert. Ambiverts have a balanced mix of both tendencies depending on the situation. They can be sociable and outgoing when needed but also enjoy solitude and deep thinking. Importance of understanding personality in learning helps teachers design personalized learning strategies, support student engagement by categorizing to their preferred learning styles, encourage self-awareness in students to help them leverage their strength, enhances classroom dynamics by ensuring both introverts and extroverts feel valued. So, understanding these personality types helps educators tailor their teaching methods to better support different learners in the classroom. Personality plays a crucial role in learning and development. Carl Jung's theory of introversion and extroversion helps in understanding how students process information and interact in a learning environment. Recognizing different personality types allow educators to create a balanced and inclusive learning experience that meets the need of all learners. Mature and integrated personality. A mature and integrated personality refers to an individual who has developed emotional, cognitive, and social stability. Such as person possess self-awareness, emotional balance, ethical values, and the ability to adapt to different life situations. A mature personality, a mature individual responds thoughtfully rather than reacting impulsively and can maintain harmonious relationships with others. The term integrated personality means that different aspects of an individual's character, thoughts, emotions, and behaviors are well balanced and function harmoniously. A person with an integrated personality does not experience inner conflict that disturb their mental peace. So, mature and integrated personality. Mature and integrated personality refers to an individual who has developed emotional, cognitive, and social stability. Integrated personality means that different aspects of an individual's character, thought, emotions, and behaviors are well balanced and function harmoniously. Characteristics of a mature and integrated personality: self awareness and self acceptance. A mature person understands their emotions, strength, and weakness. A mature person understands their emotions, strength, and weakness. They accept themselves as they are without feeling inferior or superior. They are conscious of how their behavior affects others. Example: a self aware teacher knows their strength in the classroom management but also acknowledges areas where they need improvement. Emotional stability. They do not let emotions control them but rather manage them wisely. They remain calm in stressful situations and avoid emotional outbursts. They are capable of handling criticism and rejection without taking it personally. Example: a manager receiving negative feedback does not get defensive but instead sees it as an opportunity for growth. A realistic approach to life. They accept life as it is rather than being trapped in fantasies or unrealistic expectations. They do not escape from problems but face them with courage. They differentiate between what they can change and what they cannot. Example: a student who failed an exam acknowledges the need to study harder rather than blaming the teacher or circumstances. Clean sense of identity. They have well defined values, beliefs, and principles. They do not change their behavior simply to please others. They make decisions but on their own judgment rather than external pressures. Example: a teenager with a strong sense of identity refuses to engage in negative peer pressure, staying true to their values. Responsibility and accountability. They take responsibility for their action rather than blaming others. They fulfill commitment and obligations reliably. They admit mistake and learn from them rather than making excuses. Example: a responsible employee acknowledges an error in their work and corrects it instead of blaming a colleague. Healthy interpersonal relationships. They build strong and meaningful relationships based on trust and respect. They communicate clearly and honestly without manipulation. They respect differences in opinion and do not impose their views on others. Example: a mature friend values honest conversation and support others without expecting anything in return. Resilience and stress management. They bounce back from difficulties instead of being overwhelmed by them. They remain optimistic but realistic when facing challenges. They seek solutions rather than dwelling on problems. So, example, after losing a job, a resilient person focuses on finding new opportunities instead of complaining. Integrity and strong ethical values. They uphold they uphold honesty and fairness in all aspects of life. They do not compromise their morals and or morals for personal gain. They are truthworthy and consistent in their actions. Example, a business owner refuses to engage in unethical practices even if it means losing short-term profits. Independent and self-reliance. They do not rely excessively on others for emotional or financial support. They take initiative in solving their problems. They think critically and make decisions on their own. Example, a college student manages their expenses and studies independently rather than depending entirely on their parents. Open mindedness and adaptability. They respect different viewpoints and are willing to learn from others. They are flexible in adjusting to new situations without feeling threatened. They are not rigid in their beliefs and are willing to change when necessary. Example, a teacher adopts new teaching methods based on students' needs rather than insisting on traditional techniques. So, how to develop a mature and integrated personality? Self reflection. Take time to analyze thoughts, beliefs, and emotions. Emotional control. Learn to manage anger, anxiety, and stress effectively. Continuous learning. Accept that personality growth is a lifelong process. Healthy relationship. Surround yourself with positive and supportive people. Ethical living. Follow honesty, fairness, and integrity in all aspects of life. Resilience. View failure as opportunity to grow rather than an obstacle. Adaptability. Adaptability. Be open to new ideas, culture, and perspective. So, a mature and integrated personality is key to personal success, happiness, and healthy relationships. It is marked by emotional stability, responsibility, ethical values, and self-awareness. Developing this kind of personality requires continuous self-improvement, teach learning, and advancement to life challenges. Assessment of personality. Personality assessment is the process of measuring and evaluating an individual's characteristics, patterns of thinking, feelings, behaviors. It helps psychologists, educators, and employers understand a person's temperament, motivation, strength, weakness, and emotional responses. There are three main types of personality assessment techniques. Objective technique Subjective techniques, projective techniques. Objective techniques based on standardized tests with fixed answers. Subjective techniques based on personal opinions, observations, and interviews. Objective techniques based on ambiguous stimuli to uncover hidden aspects of personality. Objective techniques. Objective techniques are structured and standardized tests used to assess personality traits quantitatively. They consist of multiple choice, true or false, or rating scale questions and are scored using statistical methods. Characteristics of objective techniques: standardized and structured, same questions for every individual, reliability and validity, result remain consistent over time, quantifiable and easy to score, use numerical values to assess personality traits, less influenced by interpretation, responses are clear and measurable. Characteristics: highly reliable and valid, standardized scoring system, less influenced by personal bias, quick and easy to administer, used clinical, educational and corporate settings. Examples of objective personality test: Minnesota Multifaceted Personality Inventory (MMPI). One of the most widely used personality tests in clinical psychology, measures emotional and psychological disorders, contains over 500 true or false questions. Next, Big Five Personality Test. Ocean Model assess personality based on 5 key dimensions: openness, creativity, curiosity, consciousness, responsibility, discipline, extraversion, sociability, enthusiasm, agreeableness, cooperation, empathy, neuroticism, emotional stability, anxiety. Myers-Briggs Type Indicator (MBTI) classifies people into 16 personality types based on 4 factors: introversion versus extroversion, sensing versus intuition, thinking versus feeling, judging versus perceiving. Eysenck Personality Questionnaire measures 3 types of personality traits: extraversion, introversion, introversion, neuroticism, stability, psychoticism, aggressiveness, impulsivity. Eysenck Personality Questionnaire. 16 Personality Factor Questionnaire measures personality based on 16 traits identified by Raymond Cattell. So number 1, Minnesota Multifaceted Personality Inventory, Big Five Personality Test, Myers-Briggs Type Indicators, Eysenck's Personality Questionnaire, 16 Personality Factor Questionnaires by Raymond Cattell. Advantages of objective techniques: reliable and scientifically validated, quick to administer and easy to score, useful in educational, corporate and clinical settings. Disadvantage of objective techniques: can be manipulated, people may give socially desirable answers, lacks depth in exploring unconscious thoughts and emotions. Subjective techniques. Subjective techniques rely on self-reports, interviews, and personal observations to assess personality. They allow individuals to express their thoughts, feelings, and perceptions openly. Characteristics of subjective technique: flexible and open-ended. Flexible and open-ended. Responses are not limited to fixed choices. Personal insights allows a deeper understanding of a person's personality, more influenced by bias. Can be affected by personal opinions, may lack reliability and consistency, prone to social desirability bias, people answering in a way that looks good. Examples of subjective techniques: interview, conducts to gather in-depth personality insights, type structured interview, fixed questions, unstructured interview, free conversation, semi-structured interview, mix of both, used in job hiring, psychological counseling, and academic research. Self-report questionnaires. In-depth self-report questionnaires. Individuals describe their own personality traits. Example: Rosenberg self-esteem scale measures self-worth. Individuals describe their own personality traits, preferences, and feelings. Case studies. Case study: in-depth study of an individual's life, behavior, and personality, used in clinical psychology and therapy. Behavioral observations. Psychologists observe how a person behaves in different situations. Example: a teacher watching how students interacting in a group project. Advantages of subjective techniques: provides rich and detailed personality insights, useful for personalized counseling and therapy, helps in understanding unique personal experiences. Disadvantages of subjective techniques: time consuming, requires delayed analysis, prone to bias. Individuals may exaggerate or hide personality traits, prone to bias. Projective techniques. Projective techniques use ambiguous stimuli such as images, incomplete sentences, or abstract shapes to uncover unconscious emotions, desires, or conflicts. These tests help in analyzing deep-seated personality aspects. Characteristics of projective techniques: unstructured and open-ended responses, no fixed answers, reveals unconscious personality traits. Reveals unconscious personality traits, helps in psychoanalysis. Difficulty to standardize and score. Interpretation varies among psychologists. Characteristics of projective techniques: unstructured and open-ended responses, helps uncover hidden aspects of the personality, require interpretation by a trained psychologist, less standardized, making reliability a challenge. Examples of projective techniques: Rorschach ink block test. Individuals describe what they see in 10 ink block images. Responses reveal deep-seated thoughts, emotions, and personality conflict. Thematic appreciation test (TACT). Individuals are shown ambiguous pictures and asked to create story. The way they interpret the images reflects their fears, desires, and motivations. Sentence completion test. Sentence completion test. Participants complete unfinished sentences with their thoughts. Example: I feel happiness when. Fill it. Used in career counseling and psychological evaluation. Draw a person test. Individuals draw a huge figure and psychologists analyze details, size, positioning, and expressions reveal subconscious emotions. Word association test.
A word is given and the individual responds with the first word that comes to mind. Example: love, happiness, positive, or pain, negative. Word association test. Advantages of projective technique: helps reveal hidden emotions and subconscious thoughts. Useful for diagnosing psychological disorders. Allow free expression without social pressure. Disadvantage: difficult to score and interpret. Result depend on the psychologist's judgment, less reliable and valid. Different psychologists may interpret result differently. Comparison of personality assessment techniques. Techniques: objective based technique, standardized structured test. Advantages: reliable, valid, easy to score. Disadvantage: may not capture deep personality aspect. Subjective: open-ended self-reports interviews. Open-ended self-reports interviews provides rich personal insights. Disadvantage: prone to bias, difficulty to standardize. Projective techniques: ambiguous stimuli to reveal unconscious traits. Advantage: help uncover hidden emotions and thoughts. Disadvantage: interpretation is subjective, lacks standardized scoring. Conclusion. So, assessing personality is essential for understanding human behavior, improving learning strategies, career counseling, and mental health diagnosis. Objective techniques provide structured and measurable results. Subjective techniques allow for personal expression but may be biased. Projective techniques reveal subconscious emotions but require expert interpretation. Personality disorders. Personality disorders are mental health conditions where a person's long-term patterns of thinking, feelings, and behaving differ significantly from societal expectations. These patterns cause distress and impair relationships, work, and overall functioning. Key characteristics of personality disorders: inflexible behavior patterns that remains consistent across different situations, difficulty in relationships due to extreme emotional responses or lack of empathy, distort self-image and perceptions of others, distorted self-image and perceptions of others, impulsivity, unstable emotions, or rigid thinking, often unaware of how their behavior affects themselves and others. Rigid, unhealthy pattern of thinking and behavior, difficulty in imaging emotions and relationships, persistent problems in social and work life, often unaware of their conditions on its impact on others. Types of personality disorders. Types of personality disorders. Personality disorders are grouped into three clusters based on shared characteristics. Cluster A: odd or eccentric behavior. People with these disorders often appear unusual, withdrawn, or paranoid. Paranoid personality disorder (PPD). Persistent distrust and suspicion of others. Believes others are deceiving or harming them even without evidence. Difficulty forming close relationships. Schizoid personality disorder (SPD). Prefers solitude and avoids social interaction. Lacks interest. close relationships or emotional bonding. Appears emotionally cold or indifferent to praise or criticism. Schizotypal personality disorder, STPD, displays eccentric thoughts and behavior. Example, believing in telepathy, magical thinking. Feels extreme discomfort social settings and has difficulty forming relationships. May experience mild hallucinations or paranoid belief. Cluster B, dramatic emotional or erratic behavior. Pupils in their cluster often have intense emotions, impulsivity, and unstable relationship. Number 1, antisocial personality disorder. Disregards others' rights, often engaging in dissent, manipulation, or criminal activity. Lacks remorse or guilt for harmful action. Impulsive, aggressive, and often violates social norms. Borderline personality disorder, extreme fear of abandonment leading to unstable relationships, emotional instability, intense mood swings, and impulsive behavior. Self-harm or suicidal tendencies are common. Borderline personality disorder. Histrionic personality disorder, HPD, constant need for attention and approval, overly dramatic, emotional, and flirtatious, easily influenced by others. Narcissistic personality disorder, exaggerated sense of self-importance and a need for admiration, lacks empathy and exploits others for personal gain, reacts poorly to criticism or rejection. Cluster C, anxious or fearful behavior. People in the cluster often experience high levels of anxiety, fear, and insecurity. Avoidant personality disorder, AVPD. Intense fear of rejection and criticism, avoid social situations due to lower self-esteem, desires relationships but feels inadequate. Dependent personality disorder, excessive reliance on others for decision making, fear of being alone leading to submissive behavior, difficulty asserting independence. Obsessive compulsive personality disorder, preoccupation with perfectionism, order and control, inflexibility about rules and schedule, different from OCD as it focuses on personality traits rather than intrusive thoughts. Diagnosis of personality disorders. Causes and risk factors. Genetics, family history of personality disorder, depression or other mental illness increase risk. Inherited traits may contribute to personality traits like aggression, anxiety, or impulsivity. Childhood trauma, neglect, abuse, or unstable environments. Brain structure and functioning. Differences in brain regions related to emotional regulation, impulse control, and decision making can contribute to personality disorders. Example, individuals with a borderline personality disorder may have an overactive amygdala, emotional center, and underactive prefrontal cortex, decision making. Childhood experience and trauma, environmental and social factors. growing up in an environment with high stress, instability, or toxic relationships. Cultural influences. Some personality traits may be reinforced by societal norms. Treatment approaches. Personality disorders are challenging to treat because patterns of behavior are deeply ingrained. However, treatment can help individuals manage symptoms and improve their quality of life. Psychotherapy, talk therapy, cognitive behavioral therapy (CBT) helps change negative thought patterns and behaviors. Dialectical behavioral therapy (DBT) specifically used for borderline personality disorder to help manage emotions and relationships. Psychodynamic therapy explores past experiences and unconscious influences on behavior. Meditation. Antidepressants help manage depression and anxiety. Example SSRI. Mood stabilizers reduce impulsivity and emotional instability. Antipsychotics used for severe symptoms. Example paranoia, etc. Strong groups and lifestyle changes. Group therapy and support network help individuals learn coping strategies. Practicing mindfulness, stress management, and self-care improves emotional regulation. Impact of personality disorders on life. Without treatment, personality disorder can lead to struggles in relationships and career due to poor social skills, mental health and complications such as depression, anxiety, or substance abuse. Legal or financial troubles in case of impulsivity or antisocial behavior. Early intervention and therapy can significantly improve functioning and quality of life. So, in conclude, personality disorders are complex mental health conditions that affect a person's thoughts, emotions, and behaviors. They can cause significant distress in personal and social life but can be managed with proper therapy, meditation, and support. A combination of psychotherapy, lifestyle changes, and social support is the most effective way to help individuals lead healthier, more fulfilling lives. Theories of personality. Freud's psychoanalytical theory, Levin's field theory. Personality is the unique way a person thinks, feels, and behaves. Freud's psychoanalytic theory and Levin's field theory are two major perspectives that explain how personality develops and influences behaviors. Freud's psychoanalytic theory of personality. Sigmund Freud believed that personality is primarily shaped by unconscious drives, childhood experience, and inner conflicts. This theory emphasized that human behavior reflects from conflict between different parts of the mind. Structure of personality. Tripartite model. Freud proposed that personality is made up of three components: id, ego, superego. Id, pleasure principle, the primitive instinct present at birth, seeks immediate gratification of basic needs. Example hunger, aggression, sex. Operates on the pleasure principle, avoiding pain and seeking pleasure. Example, a hungry baby crying for food without concern of others. Ego, reality principle, develops in early childhood around 2 to 3, balances its desires with reality and societal expectations. Operates on the reality principle, making rational decisions. Example, a child who waits for dinner instead of stealing is snare. Superego morality principle develops around age 5 to 6, represents societal moral values and concerns, guides the ego to make ethical choice. Example, feeling guilty after telling a lie. So the ego mediates between the id desires, superego morality to create balanced behavior. Levels of consciousness. Freud compared the mind to an iceberg with most mental process hidden beneath the surface. Conscious mind. Thoughts and feelings. We are aware of, example, decision making. Preconscious mind. Thoughts that are not currently in awareness but can be recalled. Example, memories, knowledge. Unconscious mind. Deeply hidden fears, desires, and past trauma that influence behavior without our awareness. Psychosexual stages of development. Freud believed personality develops in 5 stages. If a stage is not resolved properly, it can lead to fixations, personality problems in adulthood. Oedipus complex. Boys. A child unconscious desire for the mother and jealously towards her father. Extra complex. Electra complex. Girls. A girl's attachment to her father and rivalry with her mother. Freud believed personality develops through 5 childhood stages. Oral stage or 0 to 1 focus on mouth sucking, eating. Possible fixation, smoking, nail biting, overeating. Anal stage 1 to 3 years, toilet training, control. Perfectionism or anal expulsive. Phallic stage 3 to 6 years, genital awareness, Oedipus or Electra complex. Guilt, anxiety, sexual identity issues. Latency 6 to 12 years, social development, no major fixation. Genital 12 plus years, sexual maturity, relationships, unhealthy relationships. Defense mechanism. To protect itself from anxiety, the ego uses defense mechanism. Number 1, repression, blocking painful memories. Example, forgetting a traumatic event. Denial, refusing or acceptance reality. Example, a smoker ignoring health risk. Projection, attributing one's feeling to others. Example, accusing someone else of being angry when you are. Regression, reverting to child behavior under stress. Example, throwing a tantrum. Displacement, redirecting emotions to safer target. Example, yelling at a co-worker instead of your boss. Strength and weakness of Freud's theory. Strength. First theory to emphasize the unconscious mind influenced modern psychotherapy. Example, psychoanalysis highlights childhood role in personality development. Weakness, lacks scientific evidence based on a case studies, overemphasis sexuality and childhood trauma, ignores cultural and social influence on personality. Levin's field theory of personality. Kurt Lewin focused on how personality is influenced by present situation and external environment rather than past experience. Field theory, personality as a dynamic system. Levin suggested that personality is not fixed but changes based on an individual's interaction with the surrounding. He used the concept of a force field, where behavior results from two opposing forces. Driving forces push a person towards a goal, example motivation, encouragement. Restraining forces hold a person back, example fear, societal norms. For example, a student wants to study, driving force, but is distracted by social media, restraining force. Their behavior results from a balance of these forces. The life space, personal and environmental influences. Levin introduced the idea of life space, which includes everything affecting an individual's behavior at a given moment. Personal factor, example emotions, past experiences, goals. Environmental factors, example culture, social relationship, culture, current situations. Unlike Freud, who emphasized childhood experience, Levin believed present experience are more important in shaping behavior. Principle of contemporaneity. People respond to situations based on their current lifespan but not past experience. Example, a student's motivation to study depends on their current goals and environment, not childhood experiences. Psychological forces and personality change. Levin argued that personality is not fixed, it adapts to new experience and environments. Example, a shy pupil can become more confident by changing their environment. Example, joining a public speaking group. Comparison. Freud-Levin's field theory. Freud theory focuses on unconscious mind, childhood. Levin, present situation, environment. Personality structure, id, ego, superego. Levin, life, space, psychological forces. Behavior motivation, sexual and aggressive drives, interaction between person and environment. Influence, early childhood trauma. Levin's current psychological field. View on change, personality is fixed by adulthood. Personality is flexible and shaped by experiences. So, in conclusion, Freud's psychoanalytic theory explains personality as shaped by unconscious conflicts, early experiences, and instinctual drives. It introduced the concept like the ego, superego, and defense mechanism, but has been criticized for its lack of scientific evidence. Levin's field theory views personality as dynamic and influenced by current experience and environmental factors. It is more flexible and emphasized the importance of social context in shaping personality. Both theories have influenced modern psychology. Freud's work shaped psychoanalysis, while Levin's theory contributed to social and behavioral psychology.